Hi friends, good evening. I'm Dr. Ashutosh Gupta, and I practice fetal medicine. So the premise of the fetal medicine is the suspicion, right? So meaning thereby that we always are sort of circumspect of the things which is happening to the mother as well as to the fetus. पहला दूसरा meaning thereby that probably we always do a clinical assessment along with the ultrasound. So meaning thereby that are we tend to be ultrasound is a technique, and so we try to be technically correct and clinically correct. Meaning thereby that we try to mix the technique with the clinical scenario, right? So now we are discussing an important case in which the mother was an elderly gravida, and she have had some issues with her, and therefore some sort of an uteroplacental insufficiency was going on, and plus there were some issues regarding the intrahepatic cholestasis of pregnancy, and plus there was some sort of an issues with an autoimmune conditions to the mother was also going on in the background. And then we did some scans, and we just did only two scans at something around 30 weeks, and then follow up after 2 weeks, something around by 31 weeks and 6 days. And by the time probably we try to take a call, and then we there were some harbinger signs that we really picked them up, and therefore we tell them the what to do regarding the pregnancy, and then we sort of prevented a Meconium aspiration syndrome, right? So let us first go through these slides, and then probably we'll discuss all these things on in greater detail. So this is a scenario in which the baby passes the meconium into the amniotic fluid and therefore aspirates, leading to a syndrome called as the meconium aspiration syndrome. So we are seeing this lady at 31 weeks and 6 days. So we can identify that there is sort of an placental calcification going on. Even though it is a PIH thing, but the umbilical artery Dopplers are all normal. So the umbilical artery flows are normal, and then we did the biometry. So it was in a follow-up, right? So we identified it to be something around 1700 grams baby, but the amniotic fluid was 7.9, so hardly any pocket of fluid was available. And then it was being scanned done by us from 1800 grams, so probably the growth was stagnating, right? So we try to look around what actually is happening. So we identified that the turgidity or then the this coiling index of the umbilical cord has gone down. So the turgidity or the coiling index is usually 0.2. So meaning thereby within a span of 4 centimeters we should have a 360-degree turn. So this is 5.1 centimeter, leading to low coiling index. There was a chronic condition which is going on into the mother. So meaning thereby that everything as a matter of fact was slightly on higher side. So meaning thereby that the bile acids were also slightly on higher side, which was on 49, even though they were decreased. Then secondly, the growth, there was this element of growth stagnation also. So the ultrasound done something around 10 days prior showed something around 1.8 kg. Now at the moment we were telling about 1.7. So meaning there was some element of growth stagnation. Even though the umbilical Dopplers were normal, we identified that the oligohydramnios had gone down. So we were just trying to look around the complete scenario and the whole scenario, what was happening. So the placenta is also matured, so meaning thereby that we have had the hypercalcified placenta, and then the coiling index. So antenatally, when the baby is in the mother's womb, the coiling index, which is called as an AUCI, should be 0.2. So meaning thereby that within a span of 4 centimeters, uh, there should be a 360-degree turn of an umbilical cord, which is called as a coiling index. So, which was in our case was something around 5 centimeters. We hardly could identify and no 360-degree turn. So, everything all together, and therefore we asked the lady or the gynecologist to keep the baby or to keep the fetus or to keep the mother under close surveillance, and we identified that it was a non-reassuring NST, and then we took the baby out at we told them that it was 1700 grams baby, something around 1700 grams or so, and it was a thick meconium which was there to the fetus, right? So close watch onto the fetus, and therefore we were able to pick it up, sort of, and so anything which is chronically going on to the baby. and therefore all these small things they completely added upon, and therefore and we within a span of meaning thereby the 12 hours or so, so probably we took the baby out, and therefore the baby had even passed the meconium inside in utero, but we prevented this meconium aspiration syndrome, and therefore that was not there. So the take-home message is this, that all these things they have to be. So the ultrasound is a very good technique. It is a very sensitive technique. So we actually need to be technically right and clinically right. So whatever we are talking about should make a clinical sense. So everything chronically going on with the bile acids of the mother, and then some sort of an autoimmune conditions in the background, and therefore some PIH and even though the Dopplers were normal, but the decreased Liker oligohydramnios, and then the coiling index really was the sort of a pinpoint to that probably we are dealing with some sort of an MSL, right? Meconium strain Liker, and therefore we were able to take that call in the right time, and we could salvage the pregnancy, salvage the baby by preventing Meconium aspiration syndrome, right? Thank you very much for your question, Lisa.